Phoenix Children's Center for Cancer and Blood Disorders is the largest and most comprehensive program in the Southwest. Here, expert care for patients combines with support for the entire family.
Family-centered care really means that when we care for a child, we need to care for the entire family in a way that is helpful for them and help them solve and address the multiple stresses that happen with having a child with a chronic illness.
Dr. Roberta Adams is the director of the Blood and Marrow Transplant Program, a collaboration with Mayo Clinic that supports cancer patients as well as children with sickle cell disease, hemophilia, and other blood disorders.
The hematology program is one of the only comprehensive hematology program in the state. What that means for families is that there is expertise here locally in terms of treating their chronic problems. We can better offer them preventive kinds of treatment to help limit the complications that they have from their disease.
Joshua and Jordan Buchanan know firsthand about the exemplary care at PCH. The 16-year-old twins were diagnosed with sickle cell disease when they were just days old.
The pain would make us cry all the time. We'd be sleeping some nights, just going to bed, and then wake up in the middle of the night screaming and crying and stuff because it hurt so bad.
Sickle cell has affected my life with every single thing. Everything we ever tried to do, it wasn't working because sickle cell just got in the way.
The only way to cure sickle cell is with a bone marrow transplant. In 2003, Phoenix Children's, in collaboration with the Mayo Clinic, opened the state's only pediatric bone marrow transplant program, ensuring this life-saving care is available close to home. Since then, PCH has performed hundreds of transplants, including Joshua and Jordan's. The twins' younger brother, Jonathan, was their donor.
I felt so happy because I was the one that was dreaming of curing my brothers of sickle cell disease, and it ended up being me.
The twins are now cured and say they are feeling great and have PCH to thank.
I love this place. I mean, I grew up here basically. This was like my second home.
I'm doing awesome, as you can see. Nothing hurts, not my back, my legs, nothing ever hurts. My childhood is back right now.
U.S. News & World Report named PCH one of the country's best children's cancer centers, a distinction that shows in every aspect of the hospital and its staff.
I think the care that you receive here with the multidisciplinary approach with all the different specialists within our group is extremely important.
It's an amazing place, and you really want your child here when you're going through a devastating diagnosis like we did.
Sue's daughter Grace was diagnosed with acute lymphoblastic leukemia at the age of 5.
The blood test showed that she had leukemia. And so September 16th, 2011, we started our journey.
I just felt really like, what am I going to do? Because I had this, and now what is my journey? I don't really know.
Dana Salzberg is Grace's doctor and says the access to Phase 1, Phase 2, and Phase 3 clinical trials distinguishes the PCH program.
The cure rates, the prognosis changes with the enrollment on studies, and most children here at Phoenix Children's are offered studies and will actually enroll on these clinical trials in order to improve the overall cure rate.
Grace benefited from one of these clinical trials, and her mom is glad the findings may be able to help other kids.
Maybe her diagnosis was for a reason, and she can help other children, and they don't have to go through the horrible side effects that come along with the normal protocol.
After numerous hospital stays, spinal taps, chemotherapy, and a multitude of medications, Grace is now in remission.
I feel really strong, and I feel like I can do anything.
Every patient's recovery includes wraparound support from extended staff. Jessica Driving Hawk is a child life specialist.
We help patients and families here at PCH cope with the stress and anxiety with being in the hospital. We do that through developmentally appropriate therapeutic play interventions.
The child life specialists are an integral part of a patient's recovery, along with other members of the staff. Specialists in nutrition, Social work, patient education, and pet therapy all contribute to helping kids and their families cope with their diagnosis. A normal routine is also crucial, so PCH even offers a full-time school. All of these services help to meet the individual needs of each child.
You can see that the minute you walk in the door, the minute that the patient is diagnosed, and it becomes a commitment. We become part of their family, and they become part of ours.
Research at PCH is unparalleled. Division Chief Robert Arcisi says it's research that truly makes the difference.
We will not cure these devastating diseases without doing research. And that means not just applying things that we're doing, but discovering new approaches to treatment and new targets.
It's critical to learn how different patients respond to certain drugs, and access to cutting-edge research and clinical trials give patients better outcomes and much-needed hope.
This will accelerate drug development. It will improve outcomes. And I hope it will help us acquire that dream of really getting rid of this darn disease.